Vaccines are arguably one of the greatest health advancements in history. Childhood vaccinations in particular are beneficial because they not only decrease the rate of prevalence of disease, but they also decrease morbidity and mortality associated with these diseases. Vaccine-preventable diseases include polio, pertussis, dangerous pneumococcal infections. In 2007, Sandra Rusch retrospectively compiled data for the Journal of American Medical Association showing drastic reduction in prevalence after immunizations were implemented. For example, in 1952, 21,000 cases of polio were reported. In 2006, 0. That's a rate reduction of 100%. In 1934, 250,000 cases of the more fatal pertussis disease were noted, whereas in 2006 there were 15,000. It's a rate reduction of 92%. Sheldon Kaplan in 2004 noted a 75% decrease in pneumococcal infections after immunity was achieved with vaccinations. But smallpox is the ultimate example of decreased disease prevalence. Smallpox is a highly contagious and often fatal viral infection. It causes painful skin lesions, internal hemorrhaging, and according to Sandra Rusch in her 2007 study, widespread immunization for smallpox began in the 1920s. The last documented case was in 1949. This is 65 years ago. In his 2008 article for the World Health Organization, F. Andre confirms that smallpox is the only disease deemed globally eradicated by vaccines. In fact, it no longer requires an immunization to prevent the infection. Vaccines do decrease the prevalence, but they also decrease the severity of the disease. Vaccines are not a certainty, and unfortunately the disease can be contracted despite receiving immunization for it. This doesn't mean the vaccine is without benefit, however. Per Sylvan Gandin and his 2001 paper on imperfect vaccines, increased virulence is noted in patients who had contracted a disease that they had been previously inoculated against. This decreases the severity of the disease considerably. The aforementioned article for the World Health Organization states that 40% of patients who survive a meningitis infection secondary to Haemophilus influenza sustain lifelong neurologic deficits. However, those who had received the Hib vaccine prior to contracting their disease noted significantly less severe deficits. The same goes for pertussis, varicella, and rotavirus. They all reported milder symptoms with an ultimately decreased duration of the disease if they had received the immunization prior to contracting the disease. But even more significant than the decrease in disease prevalence is the decrease in mortality rates. Sandra Rusch's 2007 retrospective study again produced compelling statistics showing that in the last 13 years, deaths attributed to pertussis have decreased by 99.3%. Mortality rates for measles, mumps, rubella, and diphtheria have all decreased by 100%. This brings me to my visual aid. So my visual aid shows the drastic reduction in mortality rates from diseases once vaccinations were implemented and embraced. I converted the compiled statistics from Sandra Rusch's article into this bar graph for ease of comparison. This bar graph emphasizes the dramatic drop in death, some as great as 100%. In the case of pertussis, where rates did not hit 0, consideration should be given to the significant pre-vaccine death rate. The considerable post-vaccine decrease should still be regarded as an incredible success. Some critics argue that the decrease can be attributed to better hygiene practices, but I believe the graph supports the efficacy of vaccines since the decrease occurs relatively quickly and significantly after inoculation. The numbers make a compelling argument that the benefits of immunization outweigh the grave risks. The number of cases of vaccine-preventable diseases as well as hospitalizations associated with these diseases are at historic lows. The significant reduction support the efficacy of immunizations, as well as the claim that vaccines not only decrease rates of infectious diseases, but they also reduce morbidity and mortality amongst vaccine-preventable diseases.